One more button to push. There we are. All right, I'm going to go ahead and kick us off right now. Thank you, everyone, for your patience as we are dealing with the wonders of technology live and in person. So today, in our October webinar, we are going to be talking about successful design and implementation of telehealth in schools and libraries. We are really excited to host Christian Malaster and Trevor Cunningham from Ingenium Advisors to present today's webinar session. As a reminder for all of you, if you are new to CTRC, we always like to just go with a little disclaimer. CTRC is wonderfully supported by HRSA and also the California State Office of Rural Health. And with that, we want to provide a disclaimer that we do not provide legal advice and we have no relevant financial interest, arrangement, or affiliation with any organizations or commercial products that may be mentioned in this session. And our grant number is provided there at the bottom if you're interested. On the next slide, I'll just go over a few tips for attendees who are joining us today in this webinar. You have been muted, but that doesn't mean we don't want to hear from you. So we are going to encourage our participants to utilize the chat function and put in your comments, put in your questions. We also have Q&A made available, so you can submit your questions that way. Our CTRC team and our wonderful speakers today would love to hear from you throughout the presentation. Additionally, we do want to remind everyone that the session is being recorded, so it will be made available to you post today's webinar. If you have any other questions, please let us know. And with that, I just would like to thank Christian and Trevor for being here with us today, and I'll hand it over to you. Thank you.
Great, thank you very much. And I guess we are here. Hey, Trevor, good to see you. We were commenting on one of technology, so but that's what we deal with. And so, yeah, successful design and implementation. Actually, as I'm reading this again now in the context of what we went through here, right? Plans are sometimes useless, but planning is essential, and knowing how to use the tools and having some backup plans is really great. So. Thank you, Aislinn, and the rest of the CTRC team for giving us the opportunity to share and report out kind of the work that we have been involved with for almost 3 years here in rural North Central Washington, and that's what we're going to be reporting out here in the next hour. I encourage you to post your questions in the chat. As we go here, we'll be monitoring it and maybe can answer it right away. But also we'll have a Q&A around 45 minutes in, and then after the Q&A we'll wrap up with a few more slides. But really, if you are curious and if you want us to dive deeper into some of the aspects that we're sharing here, we're very interested in making this a little bit of a more dialogue still, given the webinar format. All right. I would like to share my slides if that is okay, because we've been having some slide versioning issues here.
No problem.
It's been a crazy day here out in, where am I? I'm in Wisconsin right now. So, all right, PowerPoint slideshow share. Good. All right, and then bring up the chat window, bring up Trevor's window. Trevor, can I see a thumbs up from you that you see the title slide? All right, good. We are in business. So, and with that, actually, I want to hand over the microphone here briefly to Trevor to give you a little bit of his background and his passion about telehealth and especially his work here with school-based and library-based opportunities.
Yeah, thanks, Christian. And one of those little changes is Christian made me first. So thank you, Christian, and kudos to you. So yeah, my name is Trevor Cunningham. I'm originally from rural Indiana, born and raised in Kokomo, Indiana, which is just about an hour north of Indianapolis. Really started my career off at IU, doing a couple of master's programs, and then really dove into the world of healthcare with my first role, kind of in a full-time position at the Indiana Rural Health Association, where I was a project coordinator and project director for several different HRSA-related projects. A lot of those evidence-based telehealth network grant programs that come from the Office for Advancement of Telehealth. After my stint there, my wife and I actually transitioned down to Miami, Florida. Could no longer work at the Indiana Rural Health Association after relocating to Miami, Florida. So really then took on a new role here with the Veterans Health Administration for a couple of years, and then transitioned to working with Christian here at the Ingenium team. So my role has really been a diverse one, working with partners all around the country in rural West Virginia, Arkansas, and mainly the program that we're here talking about today is in rural Washington. So real strong passion for the work that we're doing out there, especially with the schools and libraries, which we're going to be speaking about today. So couldn't be more happier to be on this call with all of you. And yeah, just really look forward to a good dialogue as we move forward through these slides.
All right, great. Thank you, Trevor. And the reason I put you first is so that I can talk and then go right into the presentation. But as I'm doing this here, I'd like to have everybody post into the chat what is the primary focus of your interest? Is it library-based telehealth? You can abbreviate that with LB, or school-based SB. Would love to see kind of what is the mix here in it, maybe both programs. So as I'm talking, would be great to hear from you. Good. My name is Christian Master, founder and CEO of Ingenium Digital Health Advisors. If you've tried to decipher my accent, it is part German. Well, it's 100% German, but mixed in with some British school English and 15 years in Minnesota. And so that sometimes is hard to pin me down. Started my career out in software engineering, and then moved into healthcare delivery engineering, if you will. My passion is to really enable clinicians to deliver extraordinary care through workflows and processes and training, and the use of technology. And so that is my focus and my passion that we are achieving here. So let me introduce you to the organization that has given us this great opportunity to really flex our muscles and sharpen our skills with regards to rolling out very effective school-based and library-based programs. The state of Washington applied for a Medicaid waiver in 2017, established 9 different communities, accountable communities of health. One of them was the North Central Accountable Community of Health, or now known as Thriving Together. And they adopted the mission of advancing health and well-being of the residents in their community. They quickly, the board members and other people in the organizations became interested in what can we do about telehealth. So in the wake of COVID, how can we support? It's a huge area. It's 150 miles from top to bottom. It's like 120 miles across, so a huge area, and it's only 260,000 people in there. So it's very much frontier land as a Indian reservation as well, and so great travel distances and very limited access to care within the region without the burden of traveling and transportation. And so the first thing they asked us is, could you do an assessment of what's the state of our healthcare providers here? And there's about 25 different clinical providers there. And so we went in and worked with a dozen organizations to really assess their level of maturity. So we were using this maturity model here, where organizations are either at the chaotic or emerging level. Then they graduate to be coordinated or supported with a designated telehealth coordinator. And then really the integrated means that an organization is fully able to offer telehealth as an alternative care delivery mechanism, which then really enables you to think about telehealth more strategically for geographic expansion or other opportunities, for example, recruitment of virtual clinicians. And then ultimately, a handful of organizations that I'm aware of really used rethink telehealth and digital health to really transform the relationships with their patients and how they deliver care. As we were mapping out the different organizations, as was to be expected, there were some really positive outliers. There was one very negative outlier, or very immature outlier. I should not say negative. It's a great opportunity for improvement. And actually, that little dot at the bottom in the chaotic, they waited 2 years, and now we're working with them, and they are gung-ho, and they're going to be catapulting to the top here very soon. So sometimes it's the right moment and the right opportunities. But based on that, the board then said, okay, let's set aside some funding here to really improve the capabilities of our clinical partners. And can we also do something within the communities, right? And so that was really the idea. And so we developed jointly then kind of this telehealth optimization strategy. The first one, the mission statement is very obvious: improving health and wellness in the region through telehealth. We just took their mission statement and added through telehealth to it. And the vision is really that every resident can easily access all the care they need, where they need it, when they need it. And I would like to offer that that should be the vision of all of us in healthcare. And I think it is the vision. I mean, all the digital equity programs and all the other things that we're working on are really working towards that. That access to technology should not be a barrier. That where you live should not define your health outcomes. Right. So we've talked about that a lot in the last few years around digital equity. And so, yeah, so that is the vision, and that's the one we've been working on implementing. But as I said, we wanted to have a multi-pronged approach. The first one was let's really raise the capabilities of the various different clinical partners. They include federal qualified health centers, behavioral health clinics, critical access hospitals, addiction treatment centers. Those are the types of clients that, or types of organizations that currently sign on. There's a few health systems that are doing well on their own, so they are not part of the program because they really have the internal resources to improve, to deliver telehealth at a distance well. And so that was the first prong. The second one, and that's kind of the main focus here, but I want to provide the context, is establishing access points by focusing on the community, because really this accountable community of health, this Medicaid waiver really was about not just healthcare, really health and well-being. And as we know, in healthcare, it takes a village to really raise the health and well-being of all the residents. And it takes collaborative and community partnerships in order to address the different social determinants of health. And so that's really what was done. So here's a Gantt chart of kind of what we've been doing from 2021 through 2024. So we started with telehealth services assessments and are still doing some for clinical partners that joined later. We're doing telehealth program optimization then with each individual organization that is interested and ready. And then we've also in parallel launched the school and library-based telehealth, which we'll talk about, and then also had some expansion projects, some additional funding to really take it to the next level. We are measuring the impact, so we've done a baseline assessment, and then we're not going to wait a few years until the data is available to do a post implementation final assessment on the outcome, the impact. And then also there's the digital navigation initiative that is also part of this through some other funding and other grants, but it fits into this whole umbrella of giving patients better access to care. Want to briefly introduce you to the two organizations, and with that, actually, I'm going to hand it over to Trevor because he's worked very closely with these two organizations, the school district as well as the library.
Great, thank you, Christian. And yes, Christian kind of outlined a little bit of the approach that we've taken, a multitude of different projects that are not just necessarily school or library related, but it definitely is a holistic approach for us to make sure that we work with those clinical partners to really make sure that, we work out those kinks so they can deliver care strongly to those school districts we work with. We took a couple of months at the very beginning of this stage and worked with the North Central Educational Services District. A service district might be a little bit foreign of a concept to the people on this webinar, but basically it's a regional organization that works to provide resources to all the school districts in the region. We work with roughly around 30 different school districts in the 4 counties of Chelan, Douglas, Okanagan, and Grant counties in North Central Washington. And North Central Educational Services District has been our strongest ally. We developed a strategy approach with them, working one-on-one with their school nurse corps director, really making sure that we had an ally in the region that could really show us what the needs looked like and how each school is different from one another. And then we could start outlining our basic approach to how we wanted to accomplish that. Christian, if you don't mind going on to the next slide, what we started off with was really first starting to look at what a vision looked like for this program. So simply put, North Central Washington students, their families, and school staff can readily access virtual care services to minimize the disruption to learning. We view this as really important to really establish this vision of where we want the organization or where we want this program to be, and a mission to also where we hope that we can accomplish this program in the near future. This disruption to learning was a really key point when creating the strategy initially. Again, we are healthcare people. We have worked in schools previously, but when you work with school people, in a much larger capacity, they start to, highlight some things that you may not have thought of. And really, it's our job here to make sure that these students and the staff, are not missing as they're missing as little school as possible. Schools lose money, students lose ability to learn in those circumstances, and staff lose the ability to be with their students. So it's a win-win to make sure that these services can be readily available to them.
Yeah, the other point that's worthwhile pointing out here, right? It's we're not just focusing on the students, right? A lot of school-based telehealth programs are focused on the students, but really we saw the potential and we saw the desire by the school administration and by that educational services district leadership to really not only focus on the students but also focus on the staff, right? If a teacher can only spend 15 minutes on a healthcare visit rather than taking half a day off, that is a big benefit. You don't have to find a substitute, and actually we found out later that only 60% of the substitute teaching is reimbursed, paid for. The rest they have to pay themselves. And so and we're looking here for the win-win-win. So as you, as a healthcare provider, go into a school-based environment, you need to ask your question, what's in it for them? What's their motivation? It's really about the disruption to learning is how we successfully try to capture that here. And then the future opportunity, can we also make this available to the families? Can the families quickly jump in? Can the school nurse call the parents and said, hey, we're taking in your daughter for a telehealth visit. Here's the link. You can join, and they can join from wherever they are. We can have a three-way video call, and so that was really another aspect where there was a longer term vision of really establishing an infrastructure rather than establishing a single service.
Well said, Christian. And this just brings up our mission of what we really hope to accomplish with this similar school-based project. Establish a set of sustainable virtual care services for those students, their families, and the school staff, with a focus on those who do not currently lack a ready access to the care that they need. Again, we're working with really rural communities in this situation. So our mission is to get those services to these school districts that, exist in cities and towns that have no clinics in them, have no other resources that they don't have to drive 20 minutes out to go see. So it's really going to the root of the problem, bring those services direct to those patients.
And I want to highlight here is that, again, it would have been so easy to say, here's the technology we use, here's a computer, let's do telehealth. But we really took a more premeditated approach, a more measured approach of taking a look at the strategy first and really looking at understanding, because ultimately implementing telehealth and telemedicine from our perspective is about managing change. And we need to rely on the willingness of the school counselor and of the school nurse and of the front office staff to help us to room the student, room the patient, make the connection, help us to fix any technology problems. And so with that, we really needed to just not go in and said, hey, we're going to implement telehealth and then you just bring the students. We need really to think about what's in it for them. And that's really, and then the last sentence here, right, that's the mission 2023, 2025, currently like ready access to the care they need. That was basically more or less passed down and dictated from the vision and strategy that we took with Thriving Together, because they want to make sure that we don't spend the resources on students or that already have access to care. But this is about expanding access to care versus making it more convenient for people who could easily also do it from home. So that was also an interesting aspect that that can be used and then in the implementation.
Great. Thank you, Christian. Moving on here, the other big significant partner that we had in the region also was NCW Libraries. This partner is the library system that's based out in those four counties of Chelan, Douglas, Okanagan, and Grant counties. This picture gives a little bit more of a detail of the terrain that we're actually dealing with out here. Christian had mentioned, very, very rural, but we're really dealing with this high desert type atmosphere out here. It's in places like Okanagan County, we can see even 8 people per square mile. And that may not sound like a really crazy number, but it really is. It's quite diverse and it's very, very large in this region. But we really created this strategy with them as our partners, as we did with North Central Educational Services District, making sure that we allocated key staff members that could bring diverse opinions based on their roles at the organization. And again, with this partner, a lot of these people have really strong community mindsets. They really want to do real good work in these communities, but not necessarily healthcare backgrounds. And so it's a really unique group of people to work with and really learn from one another on how we can bring our healthcare expertise when they can bring in their library expertise. As we can see here, our vision for the library-based program to be the welcoming heart of the North Central Washington community. So that's what NCW means, where people can easily connect to a multitude of social and healthcare services that they need. Really, this is a really strong vision that goes along with NCW Library's overall vision. They don't necessarily see themselves as a book distributor. They see themselves as a provider of resources to the community. And they were a really willing partner on this project and have really large ambitions to serve the community every way that they possibly can.
And what's important to point out, which is why we're putting these side by side, is that right on the surface, school-based telehealth or library-based telehealth, from a healthcare perspective and process perspective, looks very much similar. But the motivating factors behind the leadership teams are different, right? What always strikes me with this vision statement is to be the welcoming heart of the communities, right? That's what we capitalized on. And for the schools, it was disruption of learning, right? To be a welcoming learning environment and to minimize disruption. And so, again, finding the angle and finding the aspect of what's really important bodes then really well for the long-term sustainable engagement by the staff. And because now when we present this to a librarian in a rural library, it's not about bringing access to care, to behavioral health services to your patrons. It's like, okay, that's nice. But being the welcoming heart of the communities is actually stolen from their vision statement, or borrowed, I should say. And thereby it resonates. And again, it's all informed about our mindset of preparing for engaging everybody who's involved in the change.
Great. And just teeing off here on our last vision statement, establishing sustainable teleservices for patrons and communities with a focus on those who are currently lacking easy access to care. This is a really important mission statement that really drives us with this work with the libraries in particular. A key word that we haven't really touched on yet is this idea of teleservice. That's really what is stipulating the difference between the libraries and the school-based projects. With the school-based projects, we are really focusing on specialty primary care and behavioral health providers. With the libraries, we are focusing on all of those, and then also adding a little bit into the social service that I'll explore a little bit more in a couple of different slides. But we want to be really vague with how we're marketing this service. We want everyone in the community to feel welcome to use this for whatever they want to use it for, and not feel judged for using it for a specific behavioral health or substance use related condition, that no one can understand why they're going to that booth just to access some type of service.
Yeah, and the reason for that is, again, that Thriving Together is not just is not a healthcare provider that's focused on health. It's really about the health and well-being, and really totally embracing social determinants of health here. The vital conditions, 7 vital conditions, I think is what they're called. They're coming up later. The other thing notable to point out here is that it's not just the focus on the patrons. It's also the focus on the communities. So because what's in it for the libraries is also, now that they're adding this additional service, maybe they can attract some people into the library that never have set foot in the library, because they measure their success by how many patrons actually visiting and using their services, because that's how they justify the value that they provide to the community. And so with that, they saw this also an opportunity to expand their service offerings to be the welcoming heart of this community. And so that's, again, 2 elements here: communities and teleservices, as well as currently lacking easy access to care. Another kind of parallel structure here with the mission statement that we also had for the schools.
Great, and I'll just end off right here, and I'll pass it over to Christian to talk about the approach. This kind of outlines the basic strategy that we took with NCW Libraries as an example, but most of this paralleled the work that we did with the schools. First off, we looked at the strategy. We worked as a cohort of about 12 different individuals from the NCSD, NCW libraries, and also our internal teams to make sure that we understood what the vision looked like, the objectives, the goals, really set forth a realistic timeline that made sense for everybody involved. And then we started talking about what an implementation playbook looked like. How can we create a sustainable program, that can exist after we are gone from the region? We want to make sure that people have every tool necessary to take what we are creating and to be able to manipulate it, to be able to change it, to be able to improve it as they move forward, but at least leaving them with a basis to really take new services and be able to implement those. And then really to kind of cap it off right here, it's really all about this launch management and this change management initiative. So really looking at project management, workflow design, training, the different types of technology implementation. There are a lot of different elements that actually go into creating these access points that are really not thought of in the very early stages. So again, we wanted to make sure that we outlined how we would take this approach and how we could tailor this to every different school district, every single library, because all of them are going to be a little bit different and need a little bit different of an approach. But at least we can create a standard approach that we could use at all school districts and then tailor it to their needs later on.
Yeah, so this was the approach that basically Thriving Together, or formerly known as North Central Accountable Community of Health, that's what they offered as a service, as a free offering to NCW libraries. And if you're interested, right, we're going to help you build a strategy, which you already saw the vision mission statement of. We're going to build you an implementation playbook so that once our funding runs out and we've established a set of libraries, you can continue doing the work. And we're going to give you an expert team to help you to actually establish the first set of services. And so that was basically the value proposition here. And that's the framework. Okay, so we had a little bit back and forth here with the order of the slides. And so pardon me if I. On the last point here on the launch management, right? What is our approach here? And so the approach that we're taking here internally, whenever we're launching a telehealth service, is really verifying that it's a good service, which again for school-based libraries was a given based on the strategic commitment, then defining the service and then validating it and implementing it. And so what that then looks like on the service definition side is that we're really looking at what are the different workflows. And the workflows in this distributed environment, or basically there's 2 points, right? There's the school or the library with a student or with a patron. And then we have the clinical care providers, either behavioral health providers or primary care providers. And so how do we bring those two together? It's one thing when you have a direct-to-consumer visit to the patient's cell phone, but if you now have to rely on somebody else to actually put that patient in front of the computer, that is a little bit more complex. Now, some organizations, community health centers that we've worked with, they have kind of site-to-site visits, we call them, like where somebody gets roomed into a clinic room, and then they can see the other provider at a different location virtually, or even a specialist from an academic medical center. And so those are well understood. But in a school environment or in a library environment, we don't have a rooming process, right? That's new to this kind of culture. And in the library environment, we may not even want to have that to protect the privacy of the patient as well. So there's all these different elements, and that is all embedded in this workflow. Technology, very early on made the decision to make this technology agnostic. We did not want to, as ingenious as the team, but especially also not on behalf of Thriving Together, we want not to mandate and to dictate that you have to use a certain technology, because that would have further limited participation. I was thinking very hard in the beginning, how can I make it as simple as possible so that we get engagement and we don't put barriers in the way that prevent obstacles that limit engagement. And so we decided we're going to make this technology agnostic, and then we need to look at operationalization. Who do we assign to help with maybe some troubleshooting, some technical support? What if the computer breaks down? What if the computer, as in some school environments, gets stolen? But who gets involved? Who gets called? So that's those kind of service definition elements. And then we started it small off just in one school with a proof of concept, which for us is about validating assumptions and validating and assessing the risks. And then it's about service implementation then to roll it out on a larger scale. So that's kind of our framework here. of our approach. And as I've just mentioned here, one of the promises we've made here in the abstract, in the description of the webinar, is that we wanted to give you really some good lessons learned here. And it's this emphasis on workflow, very workflow-centric thinking. It's the emphasis on training, that we got to train people, and then it's about change management. And so on the workflow side, I already mentioned, right? How do you schedule? How do you reserve this telehealth access point? Because as you can now already imagine, it's probably not a one-to-one relationship between a school and a clinical provider, because we're doing behavioral health, we're doing primary care. Actually, there's multiple behavioral health providers that are in the region that may be having students in that particular environment. Now, if you have an FQHC with a school-based health clinic, that's a one-to-one relationship, but we wanted to, on behalf of Thriving Together, develop something that is provider agnostic as well. And so again, how do you reserve the room? How do you room a patron then, or a student? And then what are some of the alternate scenarios, which is our language for, okay, the happy day scenario of what should happen 80% of the time is this, but what if the student is out of the office? What if the student did not show up for school, is not in school? What if the clinician is delayed or not available? And what if the technology is not available? So all these kind of different scenarios we defined and documented, and then worked with the different stakeholders to train the clinicians and the kind of scheduling staff on the clinician side, to train the school counselor and the school nurse, and as well as to train the librarians in the schools on that workflow, on the technologies, and on some of the best practices in order to deliver telehealth in these environments. And then most importantly, always everything we're doing is driven by this mindset of we need to manage the change. We need to anticipate resistance to change, which can be in the form of confusion or frustration, but also just in blatant just rejection and or just confusion. So that's what we're looking at, and we're doing this again by engaging leadership through that mission statement, and that's the first step. How we try to win their hearts and minds. It's like, this is for you in a library environment, for your community, for your patrons, and then provide them with training, ongoing support, as well as then utilization monitoring, so that there's also an element of accountability baked in. I'm actually just, I'll just bring it up here. Don't want to spend too much time on it. But the sweet spot is obviously that we have a community access point, that we're in a community that needs it, and that the clinical partners are ready. Part of proof of concepts is about validating assumptions and learning new lessons. And we actually had, so to speak, the first library we launched, I would just declare as a great learning opportunity to avoid the F word or failure. Because we deployed it in a community that is pretty resource rich and does not have connectivity. It's a small community. It's a tourist destination that many of you might recognize if you are familiar with Washington and that area. But there's affluent people who live there, and they have technology, they have access, they have transportation, they have connectivity, and so utilization in that location was not as high because the community needs were not as high. The clinical partners also, again, this was our first project. They were familiar with school-based telehealth, but the idea and notion of having that patients actually access a community access point, we had a few patients try it out, but then they went back and said, I can do it just as easily from home, which again speaks to the community needs. But if the clinical partners are not ready, then you cannot focus on clinical needs. And if the community needs is, then we have a show pony, and that's what we have. We have a room that's really great, and we may decide to redeploy the technology. But the library leadership selected that location because it was easy and down the road, and they had a very willing and engaged librarian. So from a change management perspective, it was the right approach. But then utilization left us wishing for more, and I think these are some of the root causes we found. Mentioned the clinical partners here in the area. As you can see here, if you can see those stars on your screen, those asterisks, those are the different cities and where the different behavioral health providers are located. And as you can see, it's a vast mix here of health systems, rural health clinics with critical access hospitals associated with them, for FQHCs, as well as then two rural health clinics and quite a bit of behavioral health organizations that have been our greatest early adopters here in the region. Good. All right, Trevor, I think you're going to be. Let me take this slide here first, and then we'll see what comes on next. Division of effort. One of the things that the library leaders asked us early on, before they signed on the dotted line, so to speak, to get this service for free from Thriving Together, is well, I don't think we have time for this. How much of a heavy lift is that? So again, a lot of organizations that you work with may have had a bad experience of signing up for something and then having to work really, really hard, even though it didn't cost them anything, but just the participation. And so I was being asked to put together, it's like, okay, how much of a heavy lift is this really? And so that's what this slide is about. So for each of those different elements that we've identified here, like designing the access points, like the computer system and the room and sound installation, right? To what extent do we expect the effort to be provided by the NCW libraries, or by the library branch themselves, and or by the implementation team, meaning our team? And so as you can see here, I'm not going to go through it one by one. We could easily address their concerns and say, no, we're going to be doing the heavy lift on most of them, and we're going to involve you if and when it's necessary, like selecting a library, right? That should not be left to us. Now, we're going to be involved in helping to onboard the library and make the presentations, so it's not just all on you. You don't have, and we're going to help you, but it's a collaborative effort that we've been doing. But when it comes to like designing the access point or launching the virtual care services, that's the resources you're getting through that funding, through Thriving Together. And so that was really the kind of the value of outsourcing this, because that's not the core expertise of a library system or even a school system. It's not the design of these elements. And so that's where kind of an external outsourced partner makes a lot of sense to establish that. Trevor, if you just want to just really briefly, so we don't have to go into the details, but just
Sure.
to, explain the outline here of what we were going for and where we're at.
Yeah, so our initial approach was, again, in the strategy document, we wanted to make sure that we worked with a timeline that made sense to everybody. We were a bit ambitious with this one. We said that we wanted to get to a certain amount of libraries, a certain amount of clinical partners by the end of 2024. And just realistically, we ran into a lot of roadblocks. We ran into a lot of costs associated with the booths, and really we are really reliant now on a federal grant to fund a lot of the booth implementation. So right now we are operating with 3 different library branches and are continuing to move forward into 2025. So again, pretty ambitious. This is where we thought we'd be, and we are currently making our best effort to get to this level at some point in 2025.
Yeah, plans are useless, but planning is essential. And so at least we had a roadmap, even if we need to stretch the timeline. The approach, the conceptual approach you see here is still very valid in that we're gradually onboarding things kind of one at a time. And same for the school here. So that's the school there. There we were even more aggressive, and we've been successful. I think we will be in 10 schools by the end of this year. So we're actually doing that. Oh wait, that was just the highlight here. Sorry, I thought it was on the next slide. Good. Let me just briefly explain the playbook here, and then Trevor can hone in into some of the other details here. And again, I encourage you to ask some questions to maybe redirect our conversation to the points that you're interested in learning. But as Trevor said, we don't expect those libraries becoming experts in telehealth implementations. And so one of the things we were being asked is, can you develop a playbook so that when the funding has been allocated to launch in a number of libraries, that then we can that then libraries could decide themselves to launch additional services and follow the same process that you've developed. And then out of this came kind of this playbook here, which really lays out the different responsibilities in each of the phases. And behind of each of these boxes is basically a process design, meaning laying out what are the steps that you need to be taking. We have some templates of some emails to be sent or some documents to be created. And so that's kind of what constitutes this playbook. And so the first one is to get everybody together. Then it's about establishing the access point, then getting all the workflows designed, then training the workflows and training the first clinicians to really launch a proof of concept, and then to do the full development. And then also we're looking, last but not least, on around the performance management as well, and the operational handoff to the clinical partner. So that basically is the playbook that we've developed for the schools as well as for the libraries. So this is the library example. And we're now kind of, as we're moving towards the end of this program or at the funding, we're now preparing to kind of tie a bow around this so that it's really accessible for the schools. Any steps here that you want to point out, Trevor?
Yeah, I would say this, if there's a slide that you all want to take away from this, it's probably this one. I would definitely screenshot it. Like Christian mentioned, this is very high level. There are many different steps that go behind each one of these. Just simply identifying and preparing a teleservice space. There's many different pieces that go into that. Really establishing, is this a library have a room accessible, or is it a library that needs a booth? And really diving into how do we make that space into a proper location, a private location for all the patrons. So yeah, it's a great map, but there are a lot of pieces behind each of these elements.
Great, thank you. All right. So one of the elements that we mentioned in that framework, right, which were first just had the slide where we had the screenshot of the first page. We talked about the vision and the mission, and but then what about the actual specific goals and objectives, right? To break this down, if we think about a strategic planning approach. And so these are the strategic themes, then these are the different elements that will get us to accomplish, to achieve that vision and to live into that mission. And so again, for the strategic plan for the schools and the libraries in this time period here, 2023 through 2025, it was really about addressing the highest needs. So let's go into libraries or into schools where really access to care is difficult. And so we have stayed out purposefully, for example, out of the biggest city in the area with a large school system, because they have the resources and they have transportation and they have some more accessibility. Again, even these larger cities in this very rural area still have transportation issues, and it's a very widespread city. Actually, it's like 3 miles kind of from top to bottom, and so access to care is not a given in this community either, in an urban environment. And then the other one, the guiding principle here, just to document it, is leverage a systematic and coordinated approach, which then resulted, for example, into the development of a playbook, because that's the systematic coordinated approach. And then at the core of this it's about the strategy implementation is about establishing access points and facilitating the launch of services, right? So that's the focus. And then for good measure, and we've mentioned it multiple times here, it's then about it's optimizing the utilization, which starts out with let's measure utilization and let's look at whether this level of utilization is where we need to be. But we needed to be sure from our perspective that the processes we've designed and the training we conducted, that at least that landed. What we cannot fix is a lack of needs, or even where we ran into some challenges is still maybe a lack of willingness or creativity by some of the clinicians to really use this infrastructure and to recommend it. And we're still learning, again, from a change management perspective, how can we further facilitate that, not to push telehealth, because obviously if a patient wants to come in, they should come in. If a parent rather take the student up from school and go and see the provider in person, then that's what should happen. What we want to address is the visits that would not have occurred if it weren't for telehealth. So the comparison is never between telehealth and in-person. The comparison is between telehealth and no visit and no access to care. And obviously, it's hard to measure something that does not happen, and so that's the challenge of utilization measurement. And so, but that's what we're still continuing to learn and to identify some best practices, and really need to look at the culture of each and every organization. The benefit is that we do have good access to those clinical partners, because they also participated in the telehealth optimization strategic aspect of the overall program. So good. And then we talked about the provider agnostic model here. And so here's the visual that goes along with it here. So there's a clinical partner that provides primary care and behavioral health services to a teleservices access point in the library or in a school. And then there's a clinical partner that provides also behavioral health. Also, there could be a specialty care provider, and then we could even think about social services partners that maybe provide tax advisory services into a library, or that provide energy assistance, or that provide English tutoring services. Things they may already be offering over telehealth, but because of the lack of access to technology or privacy or connectivity, or it being a data plan or high-speed internet is not affordable for these individuals, they can now go into the library and receive access to those services. And so we're hoping that we can continue to build this out. And Trevor, you already teed this up earlier, so I'll let you talk about kind of how we thought, as I just mentioned, to go beyond just the care services.
Yeah, I'll be pretty brief here. We're almost at time. I want to give everyone an opportunity to ask some questions here. But yeah, we view this definitely as an implementation of different healthcare services, but there's such a strong element of social services that go hand in hand. Not to be punny here, but it really is a suite of different services, such as immigration, state benefit enrollment, Social Security. Just simply talking to a relative is really important in these types of situations. We want to make sure that this is a booth that is not stigmatized as the crazy person booth, or that's the booth where you get services for cardiology, whatever it might be. We want everyone to be welcome and everyone to use the booth for their own specific needs, whatever that might be.
Great, thank you. Yes, and thanks for the time reminder. I was not watching that. So here's one of the first slides here on lessons learned, right? It's the approach, if you want to replicate it in your area or take it into a unique environment, it's a co-development of a strategy. It's developing this playbook so it can be replicated, and really making sure that you have committed services partner and using a change management mindset to do that. These are the different options. So on the left is a real picture, and the right is a stock photo. But that's basically the environment that we're using. Obviously, you wouldn't pick a booth with all glass because of the privacy related to it. Although that is actually the booth that was installed in one of the locations, but I think there was still somebody coming and frosting the glass after the installation, and so. And then this is on the left here is a designated room in that library that I mentioned, and you can see some sound mitigation going on there with the panels on the wall to make this a more private action. It
actually looks like we have a question in the chat box. If you want to take a quick look at that.
Yes, I will actually tee up here the Q&A here to give people a time here, and also if you would be willing to ask us to answer us a couple of questions here. So, but in the chat. How do library schools ensure sustainable of these access point services over time, especially in areas with limited funding? So it's in the current environment, telehealth is reimbursed at parity for all intents and purposes across all various different payers. Medicare, most Medicaid programs also pay for telehealth services at parity, and then many states have parity laws and payment parity laws in place for commercial providers. And so The sustainability from a financial perspective is more a question for the clinical care providers to continue to offer telehealth services. If your question is more aimed at how can you continue that utilization, that is a challenge because the library obviously does not directly talk to the clinical providers. But that's was one of the first lessons that we learned early on, is that while we were talking to the clinical providers and we were talking to the libraries, we forgot about the step of bringing actually the both parties together, and so we corrected that in subsequent engagements, and now there's a relationship between the clinical leadership of the clinical provider and the library, and so they can talk about because if they hear about opportunities or if they want to brainstorm together some more ways to promote in the region that this is available, then that's where we're going to go. But ultimately, the best approach to marketing this particular public access point is really about a clinician saying, hey, maybe for your next visit, I know you had a lot of hassle here driving down here today. You can do it telehealth. We actually have a unit at the library, and I can give you more information on how to reserve that. So that next time you only have to drive into town to the library, and we can have our conversation there. And so that really is the best way. And then also it becomes a clinical tool where the clinician can decide whether this is the right approach for the patient or not. All right, any other questions here? And Jan, I hope that addressed your question. So if the question is how can we roll it out more, yes, there's some remodeling involved or a booth. I mean, a booth is 15 to 25 grand, so that's a huge investment. So it's much better to have a designated room, but real estate is always hard to come by, and so sometimes it's just better to buy a booth. But then you rely on grant funding. We put in a grant for how many booths in the region, Trevor?
12. Yep.
12,
For
12
Department
booths
of
in the,
Agriculture.
yeah, 12 booths in the region, and that's the USDA Distance Learning and Telemedicine Grant, which we're hoping to learn about here in a few. It's good. Jan is satisfied with the answer. All right, I think we're almost at time here, so Trevor, take us home here. So with some, again, summary comments here on some special considerations when you're rolling out telehealth in schools, and then we're also going to be looking at the libraries here.
Yeah. Yeah, and thanks everybody so much. I just want to comment real quick before we move on. Chris and I are unique implementers in the sense that we're not here to say, that we're always right. We're always consistently learning, and we hope to share those stories with you all. And we can't, we're very passionate people, and it takes a little bit of time to go through each of these slides. So we really encourage you to reach out to us after this. Really want to have a dialogue so we can continue these conversations as we move forward. But I'd love to kind of give some quick little snippets that may not have been addressed in the presentation that might be worth sharing for everybody. So special considerations, just specifically talking about the schools real quick. Obviously, in healthcare, we're all focused on HIPAA, but as well in the schools, they have FERPA, which is their equivalent of protecting their students' information. Every state's going to be different too. You're going to have some states where 13-year-olds can make their decisions on their behavioral health or medical services. Other states, it's going to be a little bit more limited. So it's just incredibly crucial to make sure that you are following all regulations, whether it be state or federal, or even community or even school-based regulations, to make sure that we're fully protected here. I know it's boring. I know it's not exciting, but this is stuff that really helps us accomplish our jobs effectively. One of the other elements here too, involve families in the beginning process. Make sure that, especially when you're doing school-related launches, making sure that board meetings are happening, that you're presenting in front of people that are actually seeing what you're doing. The last thing that we ever want to do is make a family member or a student or someone feel uncomfortable that they didn't realize that there was a service that existed, and maybe even get a different idea of what this service actually is. It can be really common for people to misunderstand what is happening, and really it's our jobs to make sure that we clearly define what the parameters are and how their children possibly could be affected by this. Just the last one about school that I'll mention here, and I'll let Christian comment as well. Build programs for students, but expect faculty and staff to use them as well. Christian really drove this home earlier, but it's always worth saying again. In these rural communities, yes, we are focused here on the students to really look at what their health needs look like. But then once we take a step back, we always find out that, oh my gosh, the teachers have behavioral health concerns of their own, or just a follow-up primary care or specialty care appointment that they can do with the equipment. So we really encourage everyone to use it as much as possible for whatever reason they dictate is important.
I'll just let you keep on going here with the
Great.
learning points for the libraries.
Great. So libraries, smooth marketing campaigns are very key. Again, I said this a little bit earlier, but it's really, really important that this booth or this space in the library is not, since it is fairly public where people can walk by it or they can see that people are going into the space, we don't want to be known as that crazy booth or that alcoholic booth, whatever stigmatized word you want to use in that situation. We just want to make sure that people realize that, oh, this is a booth where anyone can use it for any specific reason. So having community events with multiple different people involved is very, very helpful. Also including behavioral health, primary care professionals in that setting can be really great, but just making sure it's not all about the healthcare provider in that situation. And that also goes hand in hand with collaborating with community partners. We got some of our best ideas working with different outreach people, whether it be a nonprofit organization in an adjacent community or an outreach community coordinator at a behavioral health organization. Different ideas come from all over, and it's really making sure that you dive into those communities and make sure that you know who those key stakeholders are who know how to affect those people and who those people who are boots on the ground and can actually understand what the needs look like.
Yeah, Trevor, we have 30 seconds, so just walk us through the kind of key highlights here.
Yep, and just making sure higher costs are associated with the booth, making sure that you understand that there are limited or there are much higher costs than you might think with those booths. And just real quick here, primary care, just clarity on existing versus ad hoc patients, making sure that you understand what kind of patients you do want to service with the schools in particular. Understanding of the different technologies, understanding how you can use handheld devices. We didn't really touch on that much, but making sure that you can use equipment like Tyto Care or just devices that can do those vital signs. Making sure that you're understanding what the different behavioral health specialties look like. And then finally, just one last point I want to say here about specialty care is making sure that you understand that you are working with large organizations. It is a little bit harder to get things moving with them, but it is so crucial for the communities, especially when 3 hours to the nearest urban environment or academic community medical center to actually obtain those services.
Yeah, we're working with large medical centers out of Seattle and Spokane now to bring them into the region, serving their existing patients, but making it easier for them to access the services through telehealth, through those community access points in the schools, as well as in the libraries. And with that, I want to thank you for inviting us here. Thanks, Sylvia, and Aislinn for organizing this and giving us a forum here to present this. Thank you everybody for attending and for your interest, and thanks for those who posted some questions. Really appreciate that, and yeah, as Trevor said, we'll be happy to jump into a dialogue and you can pick our brains here as to maybe how you can solve a challenge that you're experiencing. Where here, as Sylvia put it, right, it's important that those lessons that we're learning are being shared and are being made public, and that's the mission of the Telehealth Resource Centers, and we're happy to contribute to that and share our expertise and our experience rather here with that.
All right, thank you so much. I really appreciate both of you for being here to present this. It was a great session. As a reminder to attendees, we will make the recording available and email that out to you within 24 hours. And reminder to join us for next month's webinar on digital navigation in the safety net on November 7th. So thank you. We'll see you all again. Thank you, Trevor and Christian, for your time so much. Great contributions, and have a great rest of your day.
Thank you as well. Good
Thank you,
afternoon,
everybody.
everybody.